In 30 years, half these meds won't be on the shelf. My name is Nick Lazipone, and I'm a pharmacist here at Mount Edgecombe Pharmacy in Sitka, Alaska. This was my first job, so I've been here about a year and a half. There's a couple different places you could work here in the hospital. Downstairs is the outpatient pharmacy, which deals with people who aren't admitted into the hospital. So I've mostly worked down there, and that works a little bit more like your usual drugstore that you're used to. And then where we are up here is the inpatient pharmacy. So here is where we take care of patients who are admitted into the hospital and staying here overnight. Someone's got to take care of the drugs that they get while they're in here too. To be a pharmacist in 2012, you need to have your doctorate in pharmacy. So here on the West Coast, a lot of times it's 4 years of undergrad school and then 4 years of graduate school, which leads up to a doctorate. You have an optional 1 or 2 year residency after that if you choose to specialize. So first thing I do is come in and get drugs out the door that people have been waiting for all night. After that, I usually go down and look through all their charts, read notes that were written by doctors and nurses over the course of the night so I know what's going on with my patients. And then while I'm doing that, I'm looking at their labs, which will start coming back. They're drawn early in the morning and the results come back in the mid-morning. So then I take what's been going on with the patient, their laboratory parameters that have been coming back, combine them with knowledge that I have about drugs, and I start to go through the drugs that they're on with kind of a fine-tooth comb. I had a person the other day that was on 3 different antibiotics, where I made a recommendation just to use one specific antibiotic that would cover all 3 problems. So decreasing the amount of drugs that people are exposed to decreases the amount of side effects and the potentials of adverse drug reactions that they could have, and overall you get better outcomes and it's cheaper for the patient in the hospital. So first of all, you need to like science. Chemistry, biology, it's what we're doing all day, every day here. And even when you go home, you still have to make sure that you keep up with new things that are coming out in the field of pharmacy. Being a pharmacist, you do have to continually educate yourself on new drugs that you're using. Sometimes a prescription does come across for a drug that you're not familiar with. Maybe you've heard the name before and you know a little bit of what it's used for, but there are professional references that we use online. This isn't like Google or something like that, and very thick books that we have access to. So it is a continual process of re-educating yourself and continuing to educate other professionals and your patients. The other thing is you need to have a lot of people skills. People, by the time they get to a pharmacy, have usually been feeling sick for a couple days, and they waited all day at the doctor's office. And then they had to come and wait in your pharmacy waiting room for another 20 minutes. So by the time they get up to your window and you get to talk with them, they're usually pretty tired. And of course, they're sick. They don't feel really well. So you have to be the person who's friendly. You have to be the person who's calm. You have to be the person who's understanding when they might not be so friendly and calm back to you. Otherwise, sometimes we just get really nice interactions with patients. You know, you get that patient who reminds you of your grandma or your grandpa. And when you find out that they've kind of been given the runaround because everyone's been really busy, if you do have the time, when you really just take care of that one patient that comes in, and they're just so appreciative of that.